I'm delighted to bring to you next Mr. Ron Borsheim, Vice President of New Business Development at BTL. BTL are the innovators and creators of EMSCULPT, one of the most innovative technologies in the last 5 to 10 years in the aesthetic space. I was first introduced to EMSCULPT and I first met Ron back in May 2018 when EMSCULPT first came to the United Kingdom. When I met Ron, I was really drawn to the knowledge that he had behind consumer insights, as well as the science behind a number of technologies that exist within our aesthetic portfolio. I first experienced the treatment when I met Ron, and I have to say, it is beyond anything that I've ever felt in my entire life. Whilst there were 7 clinical trials and studies that brought this amazing new technology to the aesthetic market, what really has captured me about this treatment is the results that are beyond aesthetics. We can feel the empowerment that it gives to the muscle, and we can also see a functional change with all of our patients who have experienced this treatment since that we've had it in the practice since August 2018. Ladies and gentlemen, I'm honored to bring to you my conversation with Ron, and I look forward to hearing more about what is going to come from BTL. Well, look,
Yes.
How are you?
Good. We're busy. I mean, we're like everyone, we downsized a little bit as a company and made sure that we kept our core people intact, and we delayed launching some products just because of the pandemic. But as a company, we're booming. So that's why we're moving forward again and starting to launch products, and we never stopped our R&D. So from the R&D side, I've got just years and years and years worth of stuff that we could bring to market. It's just a matter of when,
Yes.
not if.
Yes.
Which is good.
No,
Most companies don't have that luxury.
Yes, no, congratulations. And, I'm really pleased to hear all of that. And I hope that you and your family and friends are all well over there in the States. And,
Yep.
thank you so much, Ron, from me personally as well for your time. I can only appreciate how busy you are and how much you have to do. So
Yep.
I really value the time that you're giving me this evening over there.
No worries. I'm looking forward to it. So anything I can do to help, that'd be great.
Fantastic. Well, Ron, I think we should just go for it then, if you don't mind. I'll give you a bit of insights. But no. Hello, Ron, and welcome to our virtual patient education event. How are you?
Sure. I'm wonderful. How are you?
I'm keeping really well, Ron, and again, really excited to be able to see you again. I think the first time we met was when we brought EMSCULPT into our practice 2.5 years ago, and we met at the launch event. We were one of the first 4 clinics to bring it in. That's right.
Yes, that was a wonderful meeting, and I was very pleased how the EMSCULPT was received in the UK, because historically the physicians in the UK are very science oriented. So you don't normally bring technology to market there without expect a lot of pushback. So yeah. That's very normal for them. So I was very pleased with the way we were able to launch in the UK.
Good, fantastic. Well, we were honored to be a part of that process as well. And 2.5 years on, Ron, that EMSCULPT is doing so well at the practice. And from my perspective as the lead clinician, the results that we get are astonishing, remarkable. I would consider it beyond aesthetics. It's very functional, but I will come to that in a second. Our patients are delighted with the results. So you've created, and your company have created something that's exceptionally unique and really at the forefront of the aesthetics arena. But my patients would really like to hear a bit about you. Could you share with us a bit about you, who you are, what you do in your role, and how you came into this world of aesthetics?
Yeah, so I've been in this industry well, first of all, my name is Ron Borsheim. I'm here at BTL. I'm currently the vice president for business development and also product management. and really been in this industry for 25 years. I started with a company called Coherent, which is now known as Luminous. That was back in the mid 90s. I was one of the founders of a company that's now known as Cutera. Also worked at Cynosure 5 years, where I was responsible for the launch of Smart Lipo, which was a very, very popular product. Worked at Syneron Candela, ran a division for them for several years, was one of the founders of Thermi, and then came to BTL, been at BTL now for about 4.5 years, where I'm really primarily responsible for product management and really product development, helping develop all the new technologies. So really excited about this. And what's funny, I often joke that I have a master's degree in exercise science and exercise physiology. And with the launch of EMSCULPT from BTL, after 25 years, I finally get to use my degree in the aesthetic space. So it's pretty exciting. And because of my background, I came with a very skeptical mind, which I think helped with the launch of that product.
It's really interesting to hear, because you talk about a skeptical mind, and a lot of us, I come from a surgical background, and we also have very skeptical minds and very cynical minds, hence the robust data that a product like yours has to give when it comes to market, really. So when you talk about the story behind BTL, how long has the company been around for? Can you tell us about the legacy behind the brand itself?
Yeah, so BTL has been in the market now for 27 years. Really has two divisions. It has a medical division and an aesthetic division. The aesthetic division is actually the newest division. It's only about 10 years old, okay. Maybe 11 years old. So it's still relatively new. But BTL is one of the largest suppliers of physical therapy type technology in the world. We are a manufacturer. We actually manufacture everything from the ground up. We don't outsource really anything except maybe a component here or there, but which is really rare in today's market. Most other manufacturers truly aren't manufacturers anymore, because they get them manufactured somewhere else, and then they assemble them and then will sell them as their own. Where we build everything from the ground up. But and that's something, as a privately held company, we have the luxury of doing that. The other thing that's really important for us is science, as you mentioned. We actually launched the EMSCULPT in 2018, but we actually had approval for it in 2016. We took 16 months to finish the science, and we launched this product with 7 clinical studies: ultrasound, CT, MRI, animal histologies, circumferential reduction type studies. We took our time because we knew we were bringing a brand new concept, a brand new category to the aesthetic field, this body contouring, but shaping muscle and affecting fat, as opposed to working really either in the epidermis or in the sub-Q. We are now had the ability to affect all three zones, which was really unique. And we knew, again, from a skeptical mind standpoint, that if we didn't have the right science behind it, that we would fall short of expectations of physicians such as yourself. And that was important to us. And as you said, now 2.5 years later, we've got 30 published papers. Wow. 22 of them have been done under IRB and under IRB study. So an independent review board has looked at all of our results from a study standpoint, not just the company, but independent review boards are reviewing everything. And that's been very important to us. And 30 studies to be completed as well as published in 2.5 years is something that isn't normal in this space, but it's something that we pride ourselves on. And it's very important to us to do things that way.
Congratulations. 30 studies is remarkable. And that was one of the many key things that attracted myself to the EMSCULPT when you first introduced it to me back in 2018. And I remember when we met and you mentioned the 7 clinical trials that had been carried out to bring this treatment to fruition. And that's extremely rare, isn't it, to have 7 clinical trials when you're bringing a device to market?
Yeah, again, having a background from some of the largest companies in this industry, the Cuteras and Cynosures and Syneron Candelas, they're fantastic companies, but I think one of the hindrances of being a company like that is they're publicly traded. So they're under extreme pressure by their shareholders, not really the doctors, but shareholders to be successful. And I can remember, launching products where we had a product that got FDA clearance. We would have a single white paper done pretty much in-house or by one small physician or one single physician with a limited amount of data. And we would just be told, go out and sell. Now you have to sell. I used to equate it to a basketball analogy where the coach would just roll the ball out into the center of a basketball court and say, make up the rules, because that's really what you were doing. You had very little data. You didn't know a lot about the technology other than it got an FDA clearance and here's a little white paper. And then you would go to physicians such as yourself and say, help us figure it out. Oh, you have to buy it, but please help us figure this technology out. BTL has a completely different philosophy when it comes to that. We're going to bring you as much data as we can to help you be successful from the beginning versus helping, please help us figure this out. And that's why, BTL has a clinical advisory board, such as yourself, some of the top doctors in the United States and around the world that work very closely with BTL to guide us as physicians as to are we headed in the right direction with this science, to look at it with the critical mind as you mentioned, because that's the only way we're going to continue to lead in the body contouring arena, but in other arenas as well as in aesthetics, and that's very important to us.
Yeah, congratulations. It's a remarkable device. When I first brought it on 2.5 years ago, I guess you bring it in with hope and ambition because you want to see it succeed. I personally tried the treatment. You gave it to me. And I don't know if you remember that. And I remember thinking, I will come into this with an open mind. There's a bit of cynicism behind. However, I was curious. Obviously the legacy of BTL, you have a vast portfolio that is, very highly regarded. And I was very curious because you particularly said, I think we have something that you might be interested in. And I listened to the story and I listened to the data and the science, which was very compelling. But it was only when I felt the technology literally go through me. I'd never felt anything like that before. How would you describe that feeling to my audience out there?
Yeah, I think it's a great point because it's hard to believe. And again, that's where I came with a very cynical mind. Again, having an exercise background, I said, how in the world can a magnetic field pass into your body, elicit contractions in 90 to 100% of all the muscle fibers that fall within that field, of that magnetic field, and how can it cause these super maximal contractions in 90 to 100% of the muscles, and can also have this apoptotic effect, a secondary effect affecting fat cells. So I didn't believe it at all, but the funny thing is if you get on the table and you feel and you begin this treatment, it's unlike anything you've ever felt. It's not painful. No. It's not painful, but it's intense. It sounds a bit of a conundrum. How can something be extremely strong in terms of contracting, but have no pain? And one of the reasons is because this magnetic field is tailored to only affect motor neurons, or striated muscle, or the things that the nerve fibers that activate muscles. It doesn't affect sensory nerves, and the sensory nerves is where you're going to get from a pain standpoint. So we bypass sensory nerves. We bypass smooth muscle, things that are involuntary, and we only affect voluntary muscle, and it causes this intense contraction. But at the same time, it's not painful. But there's not a patient that gets on the table or gets off the table at the end of a treatment and says, oh, I don't think that did anything. Every person that tries this, every one of them says, oh, I know that did something. I felt that.
Yes.
And it almost becomes an addictive type of a treatment, because the first time you're a little apprehensive and it takes you a few minutes to build up to what you can tolerate. But then after that, you feel, I mean, there's a vernacular that people use. They say it feels like doing 20,000 crunches. And it's probably not a fair assessment, because it's really 20,000 forced muscle contractions, but it's something people can relate to. But you get off the table and it feels like you had one heck of a workout. You even have a little, I don't want to call it sweat, but a little dew that, from perspiration, where you've actually, it's obvious you've been working. But what's interesting is you're laying on a table. You're flat. Your heart rate's not elevated. Vasodilation a little bit, but really what you're doing is hyper focusing or creating this hyper metabolic state in a very specific muscle group, and that's what tricks the brain into thinking you're exercising harder than you've ever exercised in your life. And that's what leads to hypertrophy and hyperplasia of muscle, and that's what leads to this apoptotic effect that you can get as a secondary effect to just overflowing it with free fatty acid, the fat cells themselves, because we trick it into thinking that it needs all this energy when in reality it really doesn't. And that's what causes the nuclei of the fat cell to shut down. Just we overflow it with free fatty acids. So it's a fascinating way to look at this. And that's why even after our initial 7 studies, we had people that said, well, why this, why that? And that's what made us continue to do these studies and start to look at the flow of free fatty acids, the hypertrophy and hyperplasia of muscle fibers, which, if you look back 10 or 15 years ago, they would say, oh, you can only do that through exercise. But now we know we can do it by other means now. So it's been fascinating, and I still think we're in the infancy in terms of what we're going to learn about magnetic fields.
And thank you so much for sharing that with our patients. I think that's what I found so interesting, is the fact that you had the fat loss as a secondary byproduct of what you were trying to create for something else, for a different purpose already. So you actually got 2 benefits without even realizing so. And our patients see the results, but one of the things they certainly do is they feel it. And you're right, patients very frequently describe it as addictive. I find it very addictive. And it's almost like endorphins are released and they want to have it again, without breaking.
Yeah, it's a bit of like a dopamine response almost. They want to have it again. They want that feeling again and again. We see that. I see that a lot of times in the CrossFit athletes, people that are active, and they work out, and they're relatively speaking, they take care of themselves, but yet, like all of us, nobody's 100% satisfied with their body contouring or their body profile. So they always think, I worked so hard, but I still got this remaining little area, or this 5 pounds here or there. And we really found that EMSCULPT is a great tool to help them take that their body to that really next level. So that's been really interesting to see that.
Thank you, Ron. One of the things that I see as a clinician now that I'm 2.5 years on is the results, and I measure our results even after the 4 sessions, and I've been doing that for 2.5 years purely because of curiosity. So we take clinical photography, we do that with camera, as well as the CAMFIELD vector system as well, and it's fascinating to see the amount of contraction and shrinkage that happens even after the 4 sessions. And 2 weeks isn't a lot. So that must be the muscle contraction. Is that correct? The primary.
Yeah. So an interesting thing to look at is if you go back to the studies, and if you look at the MRI and CT scans, you see the before CT scans or MRI scans and the after. And what you see in the before is and I'll put my hand up, you'll see a body that's shaped like this. And then after just 2 treatments per week for 2 weeks, and we follow some of these patients out for 1 year, because we have a 1 year study that was just presented this year. But what happened is, it was very interesting. after 2 weeks, 2 treatments per week for 2 weeks, and then
Yes.
follow them for 3 to 6 months, the shape of their body actually changed. They were no longer this kind of circle, but the MRIs became more oblong almost, where they crunched out, and you can see it in scan after scan after scan. And it's exactly what you said. It's this tightening of the core, that really helped to reshape all the way from flank to flank.
Yeah.
But it really kind of helped to reshape their body. And often what we see in the United States here is we have quite a few doctors that have started to use this for older patients. And the interesting thing is they say the patient is grew an inch. They grew an inch and a half just by treating their abdomen, because all of a sudden they went from the slouching over to standing up tall again, because you've strengthened those muscles again. Also, an ancillary effect by with weak core muscle, or a weak core. Many times people develop back pain because the muscles in the back are trying to compensate and pull to compensate, to try to help aid those weak of abdominal core muscles. But by strengthening those, it actually relieves the tension in the back muscles as well. They stand up more straight, they get a little taller, and it relieves the muscles, the constant strain that the back muscles are under. And they say, my back pain went away.
Yes.
Something else that we didn't look at or didn't expect, but it's just anecdotally we've heard this time and time and time again, is and everyone knows a stronger core, particularly in anyone, but as you age, in the more aged population, having a strong core is key to better posture, better balance. Also can help with, and particularly with women, but also men, in some of the urinary incontinence type things that you deal with sometimes. A strong core, as well as another product we have, can help immensely with that as well. But it's the core is, the core is everything for us, as we get older.
We've always known that, focusing on the core in terms of abdominal exercises, maybe squats and lunges for our glutes, they will always help the body in the long term. But as you quite rightly said, it's the older population. And I don't like to say older, meaning 50s, 60s, 70s and beyond, but we do have a huge cohort of patients in their 70s who are benefiting significantly from EMSCULPT. And it's beyond this, it's beyond aesthetics, as we call it, because you're actually seeing a huge functional change in that individual in just 2 weeks. It's huge.
Right.
It's huge.
Yes.
Yes.
And
thank you.
And even related to that was some women post vaginal pregnancy. 60 plus here in the United States, nearly 66% of all women that have a vaginal birth experience some form of diastasis, where they have that abdominal separation that just doesn't come back. We just completed a study that was to be presented at ASLMS that talks about that closing, that narrowing of the abdominal wall separation that they get. And that's something, again, the only way you could really address that as a surgeon was to go in maybe during an abdominoplasty or something like that and surgically repair it. Whereas now you could almost use this prophylactically or use it in a preventative measure to get it as strong as they can before pregnancy, with having a stronger core is only going to benefit them post delivery in terms of recovering that again. So we've seen it both used before pregnancy as well as immediately after, and we've seen some phenomenal results. The initial results were about 11 to 12% increase. The long term with just EMSCULPT, we were up somewhere in that 16 to 17% range out. When you specifically identify women that are in that category. So that's another area from a patient standpoint. Again, 2/3 of all women that have a vaginal delivery will experience some kind of abdominal separation. And again, when you're trying to strengthen the core, it's very difficult to do that through conventional ways, because there's many exercises that you will do that you would think are perfect for the for strengthening the core, but they're contraindicated once you have more than a 2-finger separation diastasis, then they're contraindicated. So then the patient's like, well, if I can't do crunches or I can't do, certain exercises, they become very frustrated and typically don't do anything at that point. And now we have a way to jumpstart them to get those muscles strong again, where then maybe they can go back to doing some kind of exercises long term, or just keep coming back for EMSCULPT, which I think most people prefer.
Well, I think, yeah, they do actually. As you say, it's very addictive. And to your point, to add to that, you're absolutely right. It's patients losing the motivation to want to do anything because of this muscle separation or the herniation or the discomfort they feel with it, and they lose the motivation, and then they choose not to do anything at all. And that's not a great way for, the aging and the management. But you're right. I mean, absolutely everybody that I've treated, and we've treated patients with quite severe muscle weakness due to their own immobility issues. And we've treated patients all ages from, 20s right up until 78 now. And we've had success all the way through. And one of the motivations also now for patients is returning for treatment. I personally have EMSCULPT. I have all of it, my abs and the back, and now with your new arms, hand pieces as well. And what would your advice be for maintenance for someone like me who just wants to keep every 3, every 4? Any thoughts that you could share?
Yeah, and I think it's a great question, and we've done some research now where we can look at that specifically. Maybe we can talk about that in a minute. But in general, what we recommend is, first, I don't even like to call it maintenance, because I think that's implying that we're going to stay where you currently are. I want these I want them to be additive, because you're building muscle, you're growing protein. So you don't gain protein in a day, you don't lose protein in a day, and by that I mean muscle. So you're building muscle fibers. A bodybuilder, for example, they don't go to the gym and work out for 1 season and grow these huge muscles. They get to a certain level, then they kind of steady state for a little bit, and then they go in and start working hard again, and they grow on, they build on the foundation that they establish. So I really look at this as more, how do I continue to gain? How do I continue to add to what I built and what I lost in terms of muscle and what I affected fat-wise? So what our studies showed is somewhere the peak of improvement was somewhere in that 3 to 6 month range, really peaking like in a bell curve. The 4th month is kind of the peak of where everything is. So here in the United States and around the world, I have a lot of customers that are suggesting that they come in at least once a quarter for a half of a treatment. So 2 treatments in 1 week, or 1 treatment over 2 weeks, but basically half treatments. We have some doctors, because the patients have been so adamant about, I want to come back. They're setting them up on what they call a subscription program, where they pay a set amount and they come back once a month, almost like a VIP service, where they'll come back once a month for a single treatment. So that patient can say, I want to be on the 15th of every month at 3:00. And they just have a time slot, and they come in and they get their single treatment. And it's additive. It's once you get in good shape, you don't have to keep going to the gym at the same rate to maintain that good shape or continue to build. So once you get muscles fairly taut, if you keep hitting it with a stressor before it has time to start to wane or decondition, then you're going to at least maintain where you are, if not continue this injury response. Because that's really what we're doing here, is we're causing an injury response in the body. The body is saying, oh my gosh, you're stressing my muscles harder than you ever have before. So I'm going to grow more muscle fibers, or I'm going to grow thicker muscle fibers to compensate for this stress that you're putting on me. And that's the way the body does this. And the body reacts this way with collagen, with all sorts of things that we do to the body to make it change. Muscles are no different. So if you can continue to stress them, every other month or at least once a quarter, you're going to continue to benefit from your initial from your initial treatments all the way through as long as you keep going. The biggest problem we had with some of our studies, our initial studies, where patients were so thrilled with the results, and we were saying, oh no, we have to follow you for 3 months or 6 months. And they would opt out of the studies just so they could go get more treatments. So it's a very rare problem to have where you have patients saying, no, I don't want to be a part of a study anymore because I want to pay for treatments.
Yes, yes.
So it was really interesting to see that.
Very interesting. And to go on and elaborate about the point of having the treatments from every quarterly. So at my clinic, this is exactly what we do. And I think you and I had this conversation last year in Paris at IMCAS. And we were talking about the protocol of having it every 3 months. So a vast number of our patients now come back for these EMSCULPT treatments every 3 months. And I also carry out 2 treatments in a week. It works very, very nicely, and they're doing very well. In terms of the actual data, if you were to look at their muscle, do they continue to build 16% muscle? Do they continue to lose X% of fat? Does that still apply time and time again, Ron?
Yeah. So what ended up happening in the 1 year study, what we saw was, again, as I mentioned before, protein doesn't, you don't grow it, you build protein in a day, you don't lose it in a day. So what we saw is initially protein muscle development. We increased 16% at 3 months, and 19% for the fat. At 6 months, it got as high as the mid 20s, 22, 23%. So it grew an additional 2 to 3% at 6 months, meaning you continued to lose fat. You also got as high as about 19% at 6 months. At 1 year, what we saw is that the muscle pretty much steady stated, where it dropped down to right at about 18% after a year. And again, that's 4 treatments. Patients followed for 1 year, couldn't do any additional treatments. On the fat side, again, keep in mind, these are American patients. So we saw them get as high as the mid-20s, and then they got back down to about 16, 17% fat reduction after 1 year, because they just said, well, I couldn't have more treatments, and I started eating more, and it's just the sedentary life that we tend to live a little bit here more in the United States and some other parts of the world. So on the muscle side, you grew, and it steady stated and really maintained itself almost for a year with it started at 16, went up to about as high as just under 19 or right at 19%, and then dropped down to about 18%. Fat went from about 19% up to the low 20s, mid 20s, so 23%, and then dropped down to like 17% 1 year. So you did see some fat start to come back on these patients, which, quite honestly, here in the United States, we tend to see that a lot. And but on the muscle side, what they gained, they pretty much kept. Particularly if they just even did just simple, their normal routine of exercise, what they were doing prior to this treatment, then those patients, they maintained the protein and even gained it. They continue to. So if they continue to stay active and do these treatments, they're going to continue to see additive benefits to this, without a doubt.
That makes complete sense, Ron. Thank you so much for adding for me as well. And going now to the glutes, because the abdominal area is our most popular area to be treated. Everybody thinks about their core, so they're so focused on that. And the girls love their more perky derriere, so they're more keen than the gents to have their gluteal areas treated. However, we're seeing more male patients suddenly coming along at the back end of the wives bringing them in, and they're saying, hey, if you're looking like that in your underwear, I wouldn't mind some of that too. And so we're seeing more male patients coming along to have that done. But interestingly, when we're treating both, we're not just seeing an aesthetic benefit for both. We see a higher takeoff, a perkier buttock, but we're also seeing and hearing a functional change in these individuals: the back pain, the hip pain, the knee pain. Again, it's as if the whole body is just realigning again by treating both the abs and the glutes together. Do you hear that a lot?
Yes, I mean that's exactly what we hear. Particularly, like I said, whether we're doing the abs or the buttocks, we've heard the exact same thing, that back pain decreases. Functional, we have a lot of functional medicine doctors that want to incorporate this in. We also have it's interesting here in the United States, we have a lot of American footballers, so the NFL football players that are having these treatments done, because again, for them, the buttocks and the hamstrings and the quads and things like that, the lower body takes a real pounding in American football. I would probably be similar to rugby, where they just take a real pounding, and having just those muscles stronger, firing on, getting those muscles to fire more frequently has just been beneficial. But again, as you said, here in the United States, the primary person originally was exactly the women who wanted that more perky, more uplift to their bottom. And you're right. We've seen about a 25% increase in male patients coming into aesthetic clinics because of this procedure, this EMSCULPT on the abdomen and then on the buttocks. They only represent about 20% of the buttocks treatments that are done. So 80% of them are still with women. But as I tell people, again, there is, before this, there was no treatment available to do buttocks lifting type procedures to change that shape without either surgical threads or implants or something like that. This is a way to naturally do it, and it's theirs, it's them. So and we, again, Dr. Busso, who is in Miami, and in Miami, Florida, there's a large emphasis on women's bottoms, and he's one of the experts in the world, and people from all over the world come to see him and get EMSCULPT treatments just because of exactly what you said, both men and women, because they want that lifted, perkier, more youthful appearing bum than what they had previously.
So that goes according with the consumer trends and our patient trends, across the last few years. But what about the last couple of years? So last Christmas, just before, we brought in the new arm hand pieces, and that it feels so easy. It feels strong, it feels contracted, but it's such an easy procedure to actually have. And the results that you get even just after 2 sessions is very, very powerful. Now, how long would it take for the evolution of your systems to occur? I know they're probably being thought of some time ago, but how long would it take to create something like that?
Yeah, so the arm protocol is something, I mean, the arm applicators and the calf applicator is something that we developed and you guys got last year. And what's interesting is for the calves, that's another procedure that really, it seems that men are gravitating towards. Yeah. And it's kind of funny, but here in the United States, in the gyms, you'll have a lot of times where the males that are working out, they'll make fun of other males who have these ginormous upper bodies and these arms, and this chest is huge, and then they have these little tiny legs, and then the calves are really small, and they usually call them, oh, there's no leg Tuesday, must be no leg Tuesday for John over there. And and just that's the way, men always giving each other the needle to just stick the knife in. So you'll see that a lot. But so it's interesting that so many men have gravitated towards getting the calf procedures, whereas women have really gravitated, and the men have gravitated toward bicep, of course, but women both bicep and tricep, because the tricep in particular, just because of the bat wings or whatever you would call it, the arms that move. So if we can start to strengthen those muscles, we can create a more toned appearance. What's interesting about that is the evolution of EMSCULPT, and that's something we're continuing to do. So I think you're aware of this, but this month here in the United States, we've actually introduced a new version of the EMSCULPT. It's called EMSCULPT NEO. Yeah. And EMSCULPT NEO it was designed, we spent over 2 years designing this. So I know it sounds crazy, but we launched this product 2.5 years ago, the original version, but we were working on it for 6 years before then. So basically, as soon as we started to launch this product, we started to think of what are the things we can do to improve it. And so that was our goal, and addressing, continuing to address fat, an ability to affect fat in the body was important to us. An additional way to start to address triceps for women that maybe have, besides having a laxity in the muscle there, but maybe also some fat, because again, the only real alternative there are invasive procedures like a brachioplasty or some kind of laser, percutaneous laser or fiber type procedure, which are invasive. And sometimes, the scars are as bad as what they originally had, and they still wear long shirts because of that. Sometimes yes, sometimes no. But so those kind of things from physicians such as yourself started asking us questions. Okay, how do we address this? How do we address that? So EMSCULPT NEO is really the first body contouring device that actually simultaneously delivers radio frequency to address fat reduction. We actually have a clearance. We have an FDA clearance here in the United States for fat apoptosis, as well as all the original clearances that we had for the HIFEM or the original EMSCULPT technology. So in the same 30-minute treatment that you do now, we can add radio frequency on top of the HIFEM magnetic field without disrupting either one of them, and deliver enough energy to cause apoptosis, which is basically fat breakdown, the breakdown of fat cells, as well as strengthen muscle. So it's another breakthrough in technology. It's something that we had many other companies tell us that's impossible. You'll never be able to do it. And the beauty again of BTL is we have 300 in engineering on the R&D side. So I have over 300 people on the R&D side that when I tell them that other companies say this is impossible, they just start rubbing their hands together and say, let's prove them wrong. And that's what they did. So we just launched this less than a month ago. And the response here in the we launched it first here in the United States, and then also internationally in some key markets like the UK and others like that. It's being launched as well this month. But the nice part is this is just the continued evolution of this technology, and that's very important to us. This is patented. It's brand new technology, and the way we deliver the radio frequency through the magnetic field is genius. It's patented. It's something I never would have thought they'd been able to do it, but it's amazing, the technology.
Congratulations! Yeah, brand new device that you're launching in 2020 then. Yes.
So we're launching it now. It's been very, very well received here in the United States, and the nice thing is it now gives us, whereas before with the EMSCULPT, we were certainly affecting fat. We have multiple studies that show that. There's absolutely no doubt about that. But now the numbers on that side have gone where the original numbers were 16% fat and 19% for muscle growth. Yes. We're now at, we're basically at, in terms of fat reduction, we're at 30% fat reduction, and we're down at 24% muscle growth. So we've exponentially increased the ability to grow protein and the ability to affect fat, with the proper FDA clearances that are needed so that from a marketing standpoint, you can more aggressively go to your patients and say, look, now this definitively affects fat here in the United States. From a clearance standpoint in the UK, I believe you guys always had clearance for fat. Just in the United States, we didn't for the original EMSCULPT. So this was nice for us to be able to do that, because the FDA was looking for very specific things. So and just so you know, when we launched this technology, we also launched it with 7 additional brand new studies on this technology. But we still have 3 that we're finalizing because of COVID. They fell a little behind. So we didn't get a chance to, we'll deliver those early in Q1 of 2021. But those 7 studies, we did animal histologies. We did 2 human histology studies on this. We did more MRI. We did additional ultrasound. We also looked at fat cells through electron microscopy. We also used immunofluorescence to look at the production of satellite cells, which again are the precursor cells that needed for muscle for protein growth. So we looked at those. We had a 30.2% increase after 4 treatments, where we saw a 30% increase in satellite cells. We also saw a significant increase in heat shock proteins. So we, because of the radio frequency, heat shock proteins are one of the things you often look at when you're looking, again, to this heat-induced injury response. Right. You want to stimulate heat shock proteins to heal, to make better. So we looked at those as some precursors. We looked at satellite cell increase production to look at protein development. So we really tried. There's nothing I hate worse than these studies where it's all done strictly through pictures and through feelings and I feel good about this, or the patient said this, the patient said that, because we can all find some common ground that, depending on how you design the study, you can get the results you're looking for. But when you do these things through independent review boards, IRBs, and you do them where you're looking at MRIs and CTs and electron microscopy and immunofluorescence, that kind of data doesn't lie. You can't fake it. It's either there or it's not there. And that's important for us. And it's important for physicians such as yourself when you're going to your patients and saying, look, if I was going to design a study, this is the way I would have looked at it, because these are objective measurements versus subjective, how do I feel about this? We tried to take as much of that out as we could. We still wanted to get the feedback, of course, from the patient. Did they enjoy it? The other thing I can tell you, which you may not be aware of this, believe it or not, with the radio frequency and the HIFEM is a much more comfortable procedure than just the HIFEM only.
I was going to ask you, how much more intense is it going to be? Not uncomfortable. How much more intense is this?
It's more intense and more comfortable. And there's 2 reasons behind that. I know it's counterintuitive. You're going, that's impossible. HIFEM or the original EMSCULPT, I usually get up to about 70-75% of a intensity, power-wise intensity, and I'm like, no mas, no more. I can't. I'm contracting fully, and it's very intense. With this device, within 1 minute, I can get to 100% intensity on the radio frequency side and 100% intensity on the HIFEM or the EMSCULPT, the original EMSCULPT side. And the reason why, it's 2 reasons, and you'll understand both of these once I explain. One is we're pumping the muscles very rapidly. We have new pulse patterns, so I can tell you about that in a minute. But there's new pulse patterns, and those new pulse patterns, the first 2 minutes are very high in contractions, so they really get the muscles pumping. So that increases blood flow. So we're dumping all this heat into that area, but the heat is being dissipated by the radiator of the body. The blood flow, increased blood flow in that area, is then pulling out all the excess heat. The other thing is gate theory. Yeah. So this is gate theory. The brain can't figure out what it should focus on. Should I focus on heat? Which is and just so you know, these new applicators, they have impedance intelligence, where they're looking at impedance in real time. They also have thermal intelligence, where they're looking at thermal sensors that are sensing the temperature of the skin in real time. We get the temperature of the skin up to 42 degrees C within 4 minutes. We get the sub-Q, where the fat is, between 43 and 45 degrees C within 4 minutes. We get the muscle up to 40 to 41 degrees C within 2 minutes. So those are the exact measurements. And that's why we looked at, again, heat shock proteins and things like that, because, again, from other science, other studies with other devices, those are kind of the gold standard temperature ranges that you want to achieve, fat loss, or, all sorts of things. So it was important for us to do that. And that's also in our studies. We looked at all those temperature gradients and what we wanted to do. But what was interesting is is with temperature sensing in real time. Once you got to 42 degrees C, it then titrates the radio frequency based on your impedance, based on your temperature, to always keep you in the targeted zone for the entire treatment. So you'll spend 28 minutes at 42 degrees C in the epidermis, 43 to 45 degrees sub-Q. That's the perfect temperature to create this apoptotic environment in the sub-Q. But on the muscle side, when you go to the gym, you don't go to the gym and immediately start exercising as hard as you can. You warm up first. So what this is doing, we were able to make the muscle side of this function even more effectively by preheating the muscles, warming them up with this radio frequency, and then titrating it to keep them at 40 to 41 degrees C. So we keep the muscles warm, activated, and muscles that are warmed up just respond better. I mean, anyone that's ever gone to the gym knows that you warm up before you start doing whatever you're going to do from an intensity standpoint. So I think that's another reason why this leads to a more effective treatment. But it's the interesting thing, it's gate theory by, confusing the brain as to what it should focus on. Is it the contractions or is it the heat? Is it one or the other? And it kind of dulls both of them. Having temperature control and impedance control to monitor that you're staying in the optimal zones. And then also this radiator effect of once the heat goes in, affects the fat cells, warms the muscles, then the muscles then dissipates that heat. So it doesn't accumulate, because that accumulation of heat is what tends to cause problems with other technologies, whatever we're talking about. You never want heat to just accumulate unchecked in the body. You want it to serve its purpose, serve its function, and then go away. And that's what we spent years trying to perfect this, how to deliver it safely, how to deliver it at the same time as you're delivering a magnetic field, and then how to optimize it. Your original EMSCULPT has 3 pulse patterns that you use. The new one has 5 pulse patterns. We have 7 actually. It has 2 pulse patterns that you use in the first 3 minutes or so that really focus on this rapid heat rise and this rapid contraction of the muscles. Once you get past those first 2, then it cycles through 5 different pulse patterns that really focus on how to work best in synergy with the radio frequency. So they're really designed, and of course, just like your original system, the ones we use for the abdomen are different than the ones we use for the buttocks, because on the buttocks, we're trying to create volumetric change, perkiness, lift, things like that. Whereas in the abdomen, for the most part, we're trying to affect fat and build a stronger core. And the nice part is we still have 3 more studies that we haven't finished yet, which are studies for the thighs, studies for the saddlebags, which I know will be a very popular area. And then we have arms. So arms, triceps, in particular triceps, because now using the heat to not only strengthen the muscle, but also affect the fat in the tricep area. So we're very excited about that. So you're going to have a whole new treatment that where you're going to be able to go in and use that same type, and that'll be available next year. Because we're still, again, we won't release things. We don't release things until we finish the science and we look at the data and we make sure it merits bringing it into your practice. We wouldn't do that until we know for sure it does that. But we feel real good about it.
I'm sure you do. Congratulations. And the way you articulate it is so clear. It makes complete sense. And you think, yes, why wouldn't you create this ideal dream product? And it sounds like you just have, because you've got something that complements the existing portfolio. You've got something that's actually leveraging on it, building on it. And then you've got the heat component, which it all totally makes sense, really. And then you've got this device that somebody can manage through a 30-minute procedure comfortably with a desirable outcome. But I have a question for you, Ron. So if you're saying you're managing the heat at 42, 43 degrees on the epidermal layer, do we get skin contraction then?
So I can't officially say we do. As someone with a skilled eye like you will look at our pictures and you'll know right away that something is happening on the epidermis.
Yes.
As a manufacturer, that's something that we are in the process of studying,
Of course.
and we're looking at, and we'd have to submit those our findings to the FDA.
Of course.
But when you look at the pictures, there's absolutely no doubt
Yes.
that we are doing something.
I appreciate
Particularly, what's interesting on the older, we have quite a few pictures, because again, we treated, just so you know, for these studies, we did significantly more patients per study. We did over 500 patients for these 10 studies that are going on. We have over 500 patients that we've treated. That was one of the things with the original studies. People said, oh, your samples were small. We also had sham groups. We also had, we did all the things that our competitors said, oh, you should have done this to make it a better study, or this, even though they don't do studies like that. So we did. But so one of the things that was interesting was just finding this demographic of maybe an older patient in that maybe mid 40s to 70s, that age group, which I'm in as well, but maybe a little crepiness on their abdominal area, and you treat them with this, and the crepiness is significantly changed. You as a plastic surgeon will look at that in 2 seconds and know exactly what's going on there. I know what's going on there, but from a manufacturer standpoint, will allow you to tell that story until we get the proper clearances. But it's another exciting avenue that we'll be addressing with this technology as well.
Well, no, thank you for sharing with me, and I appreciate what you're saying. So, completely, you've answered my next question by talking about the evolution of your existing product portfolio, and how EMSCULPT as a technology just continues to evolve as a leader in our body contouring space, certainly at our practice as well. It blends perfectly into everything that I offer at the clinic. Our patients love the results. They continue to champion good results. And as I said, not just from an aesthetic point, you see the results, but it's something that they can feel, and they feel very, very empowered by. So on that note, I'd like to thank you so much, Ron, for your time, and also for sharing all of these insights with us. I want to end with one personal thing for myself, because it's the kind of technology that sounds too good to be true. And I remember when I brought it into the clinic 2.5 years ago with no patient results. It was brand new to the UK, one of the first few devices outside of the States, brand new to the UK, outside of the world, and I had no results. I have hundreds of results now. So I'm completely convinced, and our patients are convinced. And one of the things that strikes me is the robust clinical data. I mean, look at the amount of time, energy, R&D investment in your CT, MRI, histology, biopsy data that you have, the clinical trials, not just 1, 2, but 7 to bring this to fruition. And that's one of the things that I try and empower our patient audience with. These aren't toys. This is some serious tech.
Yeah, I agree 100%. And that's the one thing that I think BTL really is prides itself on, and really is becoming known for, is our commitment to science and our commitment to doing it the right way. And that's not a knock on other companies, but there's just different motivations for them. Again, being a privately held company, we don't feel the stress or the pressure to perform for our shareholders. We hold back. As I mentioned before, I've got 5 years worth of research that's going on in multiple platforms, not only EMSCULPT, but all sorts of things that we're developing, and just figuring out when is the right time to develop it or bring it to market, or not. And that's again, it's a luxury that we have, and we really pride ourselves on is doing things the right way. Again, we had clearance for this product back in December of 2019, yet we're just launching it now because because of the coronavirus, without a doubt, without the pandemic, but more importantly, we wanted to have at least 6 month data. So we launched everything with the 3-month data, but we've already collected all the 6-month data, and we're tabulating that now. So early in Q1, we'll be able to give the 6-month data. And to us, that's really important. And by then we'll have 10 studies, all IRB studies, all have already been accepted for publication. It's just a matter of, slotting them in. As you know, that's a long process sometimes, but it's very rare that such new technology gets accepted so quickly. And I think it's exactly why you say it's because we did our homework and we did the science, and we, like you, we use some of the best physicians in the world. They help lead this product and further it. And we wouldn't be able to do that without, physicians such as yourself and others around the world that give us great ideas and say, hey, I'm seeing this, you should really look at this. Or it goes without saying, we pride ourselves in the science and also working closely with some of the best in the world. So we're appreciative of the support that you give us, and the results you're getting are just, it's part of the science we did, and it's part of the skill that's, comes through your practice as well.
Well, I hope that you'll be able to come visit my practice one day soon. We know when all of this is, come to the other side, whenever that may be. But on that note, I'd like to thank you so much for your time, Ron. We've met not just once, but twice. And, you certainly caught my attention as an innovator in your field and with your company, and it's a product now that's very close to heart and close to abs and everything else with my patients as well, close to the core, so to speak. But ending on a note of positivity, gratitude, and inspiration, really. I always like to end these things on that note. Do you have anything to share with my team, my patients, our audience during this time?
No.
Before we say bye.
I just think that, again, this has been a trying time for all of us over the last 6-8 months. Here in the United States, if I could say anything, it's been interesting that we've had many patients that are gravitating towards this type of technology because they've been cooped up for so long, and really, they don't want to get out into the world, or maybe, gyms are still closed here in the United States for the most part in most states. So we have many physicians that they're saying, look, the gyms are closed, come and work on your core here. Let's get your core back, in good shape, so that when you can go back and start exercising again, you're not starting from ground zero. You'll be at a good level. So I think, again, there's a lot of opportunity to embrace this type of technology, to start to jumpstart 2021, because I totally believe things will change. Things are going to get better. I think there's going to be vaccines, and we're going to figure this out. And when we come out of the other side, I think having a good foundation on your fitness would only be a benefit. And this is a great place to start. That's what they're doing here in the United States. We have doctors that are as busy as ever with this technology because people are coming to get their medical gym membership, almost a medical gym membership. And so I can see that translating to other parts of the world as well. And, again, as one of the top physicians in the world, your patients are lucky to have you, and your insight and your staff and your team, I'm sure will guide them in the right direction. And BTL is just, happy to be a small part of that. So I look forward to coming as well. I was supposed to be in the UK this summer with my son for some soccer, and we didn't get a chance to do that. So hopefully next summer I'll come see you, if not sooner.
Absolutely.
So I look forward to seeing you as well.
Thank you so much, Ron, and thank you so much for your time, for sharing all of your insights, the legacy, the future trends, and where it's all heading. In fact, it's already happening now. But on that note, I wish you all the best, and I wish your teams, your company, all the very best, and you and your family good health. Thank you.
Thank you. Cheers.
Hi guys, happy Self-Care Sunday. Today I wanted to talk to you a little bit about something different, EMSCULPT. Basically, ever since I've had knocks, I've not been able to retone this area, and I've been suffering dramatically actually from lower back pain, so much so that I can't sleep at night. But last year I was invited down to the S-Thetics anniversary event at Hetzer House, and I was lucky enough to try EMSCULPT for myself. EMSCULPT sounded too good to be true, but I've now seen the effects and I'm so excited to share the process with you. I like to think of myself as quite a fit person. I occasionally work out, and there are certain areas that I just can't seem to address. Ever since having knocks, I've got this little paunch here, and I've also suffered very badly from back pain. And I've been told that actually EMSCULPT is so powerful that it's not just for toning and aesthetics, it actually can totally transform your lower back strength area as well by drawing in the core and making you work. So I'm going to take you through the process. Over the last 2 weeks, I've been going into the aesthetics clinic in Beaconsfield for 4 separate treatments. So over the treatments, you'll have a course of 80,000 maximal contractions. And these contractions are designed to sculpt and also lose fat in the areas that are unwanted. So for me, it's this lower region. I'm going to show you exactly now. I am 2 weeks post-treatment, and I have to say I'm already starting to see more definition here. But I won't see the full effects until 3 months later. So I'm going to talk you back through each of the different sessions and how I felt after each one. First process of EMSCULPT is having some pre-treatment photos to see your before so that you can see the big change in the afterwards. So I'm going to be standing down on those little footprints, turning around and looking at all my different angles. So we are in the EMSCULPT room now. Amy and I are having a party in our pants.
Socially distant.
Quite literally. And we're going to hopefully tone up our tummies today, aren't we? So I'm halfway through the treatment now, and we are at 100%, which is 20,000 maximum contractions or maximal contractions. The pulsing is actually to stop DOMs, so we shouldn't have any pain tomorrow, despite the fact that we've been working our bodies to the absolute maximum. Just finished the first treatment, and I'm definitely feeling a lot more toned, a lot more engaged, and really excited to see the transformation over the next 4 treatments. The EMSCULPT bed today for my second session, or my second treatment. Managing to keep my dress on, which is amazing. So even if you're short of time, you're in your lunch break and you want to go and do a workout without having to work out, it's the perfect solution. We are on 100% with 19 minutes left to go. In the aesthetics clinic in Beaconsfield for round 3 of my EMSCULPT today, and I'm so excited because I'm finally starting to notice some of the results. Obviously I could feel it working after session 1 and session 2 as well, and we were just chatting earlier and Amy was saying she can even feel extra room in her jeans, so I can't wait to feel it. Here for my final session of EMSCULPT today. I am nervous, excited, and I absolutely cannot wait to see the results afterwards. Today I tried a plank for the first time and I did it with ease and actually felt new muscles engaging, so it's definitely working. And yesterday I was doing some yoga stretches, and even though I had absolutely no DOMs, when I did a back bend I really felt a stretch going through my core, so it's working. Amy and I are here for our 4th session of EMSCULPT. What has been your favourite part of it?
I just think the intensity of using your muscles and also doing it together. Like, I really can't wait to see your results as well as my own. So.
For me, I would say that we've been able to do it together and been one of the best things, and also working muscles that I've never even felt before. 10 out of 10 for us. 23 minutes left to go on our final session of EMSCULPT, and I have to say, each contraction feels even more engaged, if that makes sense. And both Amy and I have been in absolute fits of giggles, haven't we? It's one of those feelings where it's in no way painful, is it?
No, but it's like you say, in a weird way, it's like an intense tickling, which sounds really bizarre, but...
That's exactly what it's like. It's like the most intense tickling without any pain. It just makes you laugh and works at the same time. EMSCULPT itself is designed to not only contour the stomach area, but also lose fat. So it's even possible to lose up to 16% body fat. And for me, it's not really the fat that I'm wanting to lose, it's just the toning. It's physically impossible for you to get maximum contractions when you're working out yourself. So the EMSCULPT machine using Tesla magnets is designed to get maximal contractions. Each session, you'll be doing the equivalent to 20,000 maximal contractions. So that's more than 20,000 sit-ups, which is quite astonishing and probably wouldn't do in a year. So by the end of your 4th treatment, you've actually done the equivalent of 80,000 maximal contractions, which is quite literally mind-blowing. So as I said earlier, I'm about 1 week post-treatment, and I have to say, I've been doing a few different exercises to test my ability in the strength and the ease between each movement, and I'm going to take you through them now just to show you and talk you through exactly what I found easier. So this is one of the movements I wanted to try straight away after my first treatment, just to see if I could notice any more development and strength within my core. So as you can see there, I felt like that was quite a smooth sit-up. Usually I kind of jerk my way back up. Ever since having knocks, I've really struggled to draw my core in. The second movement I wanted to try was a plank. Plank is a movement that I used to really struggle with the positioning and the pain in my lower back. So I am going to see how long I can hold it for. Wish me luck. So coming back in there, I definitely feel a lot more strength, and actually I can feel a different muscle working that I've not felt before. Really deep muscles within my abdominals. One of my favourite things about EMSCULPT is that you can do it with a friend. So when the EMSCULPT machine is on, there's actually 2 different magnetic devices coming out of it. Each session is 30 minutes. You get to feel exactly what's going on together, talk about it, analyse the whole process, and then it's so exciting to see both of your results as well. So I took along Amy with me, and I have to say the whole experience was all the more fun doing it together. Both Amy and I were talking about the fact that it actually feels a little bit like acupuncture. You can feel it really targeting one area, and there's almost an endorphin release at the same time. It's like an intense tickle without the tickle, if that makes sense. There was absolutely no pain at all. I know that some people do talk about some sort of pain, and I think that's possibly anxiety about what to expect, so you're almost tensing whilst the whole process is going on. But because we've been there together, we've been chatting, we've been relaxing and discussing how it felt for each of us, it almost made the whole process quite a calming experience, if that can be at all possible. So I hope you guys have enjoyed my insight into what EMSCULPT has done for me, and if you have any questions, please comment below and I'd be more than happy to answer them. And I hope you have a great Sunday. Bye!